Hello guys, welcome to our channel. Today we'll be discussing the exam day strategies, do's and don'ts and important instructions that you have to follow for the examination guys. So big day is coming. I hope you're all prepared well. You still have the time. So just prepare the glimpse of your error notebook or the bookmarks that you have had. So that might help you in the last one day. So sometimes you can just take the rest also. Don't have to read anything. Just be confident and spend it with your loved ones. So okay guys, those who are new to this channel, please do subscribe and share with your friends, and let's discuss the what are the do's and don'ts of the FMGE examination day. So let's start the discussions. So remember the thing guys, that everything is hard until or the before it is easy, right? Whenever in the, let's understand, like when you started to walking it is hard, when you are started to write it is hard to write, whenever you started to read it is hard, but if you observe that, everything will be easy today. So imagine a toddler has started to learn walking, but today he can run also, right? It is just time, matter of time, that everything will become the easy. Just hope for the best and be optimistic. So first thing and foremost important thing is, have some good sleep before the examination day and have a light balanced meal. That should be important guys. Stay hydrated, because if you're dehydrated, if the examination hall is already having some issues with the ventilation, then you will be sweating and it is hard to focus on the examination. So stay hydrated, eat a light balanced meal, don't eat the fast food, because to avoid the gastritis, gastroenteritis, vomiting, nausea, everything, so that should be avoided. Just have a small meal or the small breakfast before the examination, and have the good sleep before the examination day, because again you have to focus on the examination at least 2+ hours, right? Paper 1 and the paper 2, that is important. And you all know the date and time, right? So 28th June, so it will start from the 7 a.m. So gate opening will be start from the 7 a.m. Last will be 8:30 a.m. You should be there, and 9 a.m. exam will start. Paper 2, 12 p.m. they will start open, and until 2 p.m. the 2 p.m. examination is going to start, right? Next, what should be carried? Admit card, and it should be color printout guys. Admit card should be in the color printout, and then you have to carry the valid original ID of the government, any one of the following, for example PAN card or passport, driving license, voter ID and Aadhaar card, any one of the thing that you have to carry to the examination hall. But admit card and one of the ID card is very important, and I prefer you carry passport and the Aadhaar card, because we are FMG also, everyone will be having the passport and then Aadhaar card. Don't forget to follow this. And in Aadhaar card they have given the other instructions also this year. Aadhaar card should be color printout, either it could be electronic or it could be original also, you should carry. And biometrics, they should be unlock and then lock Aadhaar card system is also, because to avoid the impersonation they have instructed for the Aadhaar card identity, but carry any one of the important government ID that you are holding. Next, reach the examination center very early guys, because remember paper 1 you have to reach by 7 a.m. and for the paper 2 you have to reach by 12 p.m. right? This should be, avoid the last minute panic, traffic issues, fuel issues, anything, but be there at least 2 hours prior. Next, another important thing is what should not be carried, like all the electronic gadgets that should be avoided. Pen drives, scanners, pagers, cameras, jewelry, metallic items, belts, pens, pads, papers, pouches, stationery items, pencils, eraser, geometry, goggles, anything. All these are avoided. This should be avoided. Okay, don't carry any of these things. And do's, in the examination hall, don't be panic, be confident, because see they have issued that if the NBME do any mistake also, it doesn't matter guys, but if we do any mistake, because our career will be spoiled, right? So impersonation, seat swapping, looking into other computers or talking to others, forged documents, carrying any of these things, they said that they will cancel the examination and they will complain to the police station. So even in the panic also, don't look into others, don't talk into others in the examination hall, right? So please follow these instructions, and there should not be misunfair to any one of us. Okay, next, read the questions carefully, don't rush and panic. Question, read, then options, then answer. Don't just immediately rush to the answer. That should be avoided, because 300 questions you have equal time, each question you have 1 minute, right? That should be Keep that in the mind. Don't rush yourself and attempt what you know the first, and don't waste the time, and do attempt all the 300 questions, because we don't have negative marking. So negative marking is not there. Every point will get 1 mark. So do attempt all the 300 MCQs. Next, a 58. So let's see how to strategize questions. For example, whenever you see the clinical questions this long, just read what is the last line. So they are asking what is the diagnosis. What is the diagnosis of this patient? Next, let's read the question. 58 years old man presents with a fatigue, pruritus, right upper quadrant pain, and his labs shows the anti-mitochondrial antibodies positive, and biopsy shows the granulomatous inflammation. So this is likely to be the autoimmune condition. Next, let's go by the options. Eliminate the options. So alcoholic hepatitis. Is there any alcoholic history? No. Eliminate this option. Chronic hepatitis B. Is there any options with the chronic hepatitis B? That does the patient have any history? No. Avoid this option. So two options are eliminated. So you are left with either A or the B. There should be only one answer. Now, so you can identify by the instincts that given in the question itself. Old man with the autoimmune condition. So probably this patient is suffering from the autobiliary cholangitis. So this is the biliary cholangitis that the patient might be suffering. So instincts, go by the instincts. If you see the sclerosing will be in the younger individuals, females most commonly, right? Or you can see their related anti-mysomial antibodies, cholangitis antibodies, right? Or the patient might be having the history of the ulcerative colitis, other history. So like that, you have to go with the instincts, eliminating the options and the keywords from the question. Next question. Which of the following statements are true about the beta blockers? Right? So I have read the wrong question. So don't panic yourself also like this. So most of the people will be forgetting this one. Okay, they're asking about not true. So they're asking about the false statement. So exceptions, not, or some question, or asking about the false statement, all this should be keep in the mind. They are not highlighted like I highlighted here. So don't rush yourself reading the miss question. Okay, you will miss the 1 mark. That 1 mark can decide your score also. So read the properly. Exceptions, not questions are most important. Let's see beta blockers. Again, eliminate the options. They reduce the myocardial oxygen demand. That means they are decreasing the heart rate, right? So this is a true statement. They are contraindicated in the asthma patients. Yes, beta blockers are contraindicated. This is also true statement. They can mask the hypoglycemia symptoms in the diabetes. Yes, this is also true statement. So these A options are eliminated. So only option that is left is this option, D option. So our answer is D option. Even if you don't know that D option is right or wrong, but you already eliminated all the options, that is only left with us. Next, see what is the D option is telling. They increase the renin secretion. Actually, beta blockers is acting on the blood vessels, heart, lungs directly. They are not acting on the kidneys. So this is renin production itself. Wrong option that is telling. If you see the renin related, either it could be ACE inhibitors or the drugs that is related with the herbs, but it is not the beta blockers. So eliminate the options, read the options last line. Is it the exception? Is it the not? Is it the false? Is it the true? Like that you have to differentiate. Next, go with the image based questions. How to attempt the image based questions? So what is the diagnosis of the ECG? For example, if you see last line, what is the diagnosis of the image, that is ECG? Let's go with the history. 76 years old woman, emergency department, palpitations, shortness of the breath, BP was stable, pulse was irregular and 120 beats per minute. Now go with the options. Atrial fibrillation. What is the atrial fibrillation? Let's see ECG. Does the option and the ECG will work together? So in the AFib, what happens? P waves are absent. Yes, here also P waves are absent. Irregular rhythm. Irregular rhythm. Yes, this is also having the two criteria. Okay, so our option could be A options, but don't directly answer this. Let's go with the other options also. For example, SVT. SVT is also P wave is absent. Yes, P wave is absent here, but SVT does not present with the irregular. It is has to be regular. So this cannot be the option. So SVT is also cancelled. Next, Mobitz type 1, Mobitz type 2. Both are related to the decreased heart rate, right? Less than 60 the patient might be having. Here itself the patient is having the high heart rate. So these two options are also eliminated. So go with the elimination of the options, option plus image, option plus image, so that easily you can answer that question, right? Next, don't skip the sleep before the examination, because it might be decreasing your focus on the examination, because you will be feeling that drowsy and you will be marking the wrong answers. Don't skip the breakfast. Light-hearted breakfast is important, because energy will increase your focus, and focus will increase your most of the right options. And don't discuss the topics and the answers, guys. Don't discuss to anyone. Even if you reach the 2 hours 3 hours before also, please don't discuss the facts, don't discuss the examination, don't discuss anything. Just spend whatever your timings, whatever the free time, whatever the free things, chill things you have to discuss, and don't discuss about the topics or the answers or the facts. And avoid the confusion before the examination hall. Same with the paper 2 also. Before the paper 2, don't discuss about the paper 1. I didn't mark this, I didn't answer this, I made this mistake, or I passed is passed. Just move on and think about the paper 2. Don't discuss about the paper 1 before the paper 2 examination hall. Next, don't change the answers repeatedly. I have seen many students, they will change the repeats. First thing is first thing, that is important. Okay, as we say, first impression is the best impression. Same like that, first instinct is the correct option only. Even if you change the 30 questions, not 10 only correct and the remaining 20 is wrong. So see, how is a successful strategy is this? So don't change the answers repeatedly. Whether you know or they don't know, don't just don't blindly mark. Just think your common sense. Common sense can make the changes sometimes. Okay. Next, don't waste your time on the one questions. I will tell that at least you should have the less than 2 minutes you can spend on the question. Okay, less than 2 minutes per question you can spend, but more than 2 minutes, 5 minutes, 7 minutes, 10 minutes, that should be avoided. Okay, just move on to the next questions, because it is a time bounded, guys. Time bounded means it is like a clock is already ticking. You should be avoiding that. Next, don't panic. It's okay to leave some or the guess questions, because see, we are actually having the 300 questions, right? 300 questions. And I'm telling you now, 200 questions are from the PYTs, right? Another 50 questions is about the common sense or the general knowledge of our MBBS, not the social general knowledge. And the remaining 50 questions are unknown. Okay, these are the unknown, or let's say these are the bounce backs. No one will expect that questions. So you still have this chances, probability of winning these 250 questions. And I can say 200 questions you can easily answer this. So 200 out of the 300, you are already passed this examination with the high score, right? So don't just panic. It's okay to leave some questions, it's okay to guess some questions also, because use the common sense. But don't just leave the questions. 300 out of 300 you have to attempt. Don't just get stressed or the anxious if you see the unknown topics, right? These are the points that you have to remember. Next, don't lose your confidence or the courage. For example, you see first question unknown, second question unknown, third question unknown. Yes, what happens? You still have the 297 questions is waiting for you. Who knows, that might be easy. So don't lose confidence by the just primary instincts. Okay, don't just lose the confidence or the courage. You already have gone through the hard year, half year, 1 year, 2 year. You are just training yourself for this only now. You just face it and give your confidence and give your best in this examination. You show your potential, what you are capable of this. And all the best, my gems. All the best to FMG repeaters, to the warriors. I know you are all the warriors only. Don't just think about this attempt, that attempt. Doesn't matter. Just past is past. Just move on and give your best in this examination. What I said, don't change the answers. Don't panic. Don't discourage yourself, and be confident and go by the time and carry the important documents, and just feel confident. Okay. So it always seems to be impossible until it's done, right? It always impossible. You never have thought that you are going to complete the MBBS. You have completed. You never have thought that you come here and attempt this examination. You are attempting this examination. So we all seem to be impossible. Someday it will be possible and it will be done, right? All the best, everyone. Just stay safe and stay confident and give your best in the examination. And I'm all waiting for your excellent results and the marvelous results from your examination results. Okay, all the best in advance and congratulations in advance, and waiting for your results is only the day and time is left, right? So give your best, guys. Stay confident and give one of the best examination attempt that you are going to give this time, right? So those who are new to this channel, please do subscribe and share with your friends, and don't forget to like and share with your friends, guys. So see you in the next video. See you all the best once again.